Good morning. I'm Dr. Jessica Saepoff, and you're listening to Dental MD radio show, which every Wednesday morning from 9 to 10, I'm here on KKNW 1150 AM. Now, I have talked about a lot of different dental topics, and today I'm going to cover root canal treatment again. And you can also go back and look at listen to, it's radio, my archives on 1150kknw.com. And today I'm going to talk about root canals because I have learned, more things. I go to continuing education courses and for alternative medicine and dentistry. And every time I gather more information about various dental topics, then I come back and revisit those topics and add to your knowledge base. I am sharing what I've learned with you. So the reason I do this show is so that you, the listener, can get information that may be hard to come by or that is not available unless you ask the right questions. Some things just don't come to light until you ask or investigate or research. But if you don't even know what to ask, then you may not have that information revealed to you. And it will be revealed to you in one way or another, either through a book or happenstance or someone mentions something or, you know how the law of attraction works. You put out an intention or an inquiry or a request or a curious minded thought, and before you know it, some people, the turnaround on receiving answers and information is pretty quick, and other people, you have to be patient and you have to just put it on a back burner, know that you've put that intention out there, and just wait patiently for something that resonates with that or is a match for that to show up in your path. And I've always operated as though that's true, and it has always been true. And the time it takes for answers to show up in front of me to something I've wondered about has gotten shorter and shorter over the years. So being in a state of wonder and curiosity is probably the most powerful way to send out the vibration of your query, your question, your whatever topic it is that you want to know more about. If you send it in the attitude of wonder and curiosity and openness, you will get some good matching results in your life. So today I'm going to talk about root canals. So if that's a synchronicity for you, if you were just asking someone about root canals or you were just in a dentist's office and they were talking about possible root canals for you, well, then the timing is right, and this may be the show that answers or brings you some information that helps lead you to the answers that are appropriate for you. Or maybe leads you to more questions. That's fine too. That's all part of the process of getting to where your gut tells you, okay, this is what I'm going to do. I'm happy with that decision. I'm making a choice, an informed choice after looking at everything that is relevant for my situation, comfortable with your choice. But it takes time to get to that. And, you know when you've gotten to that point, and you know when you have made a choice and none of the other options feel suitable any longer, even though they may have until you got all of the information that was relevant for you. So we have to trust that inner knowing, that inner instinct. And it is very difficult. It is very difficult in this environment of outside of us authorities that have whatever credentials they list off that then tell you what you should do. And that's fine. You can listen to that as, here's somebody with credentials telling me what they think I should do. not telling me what to do, but telling me what they think I should do. You can sort of realign it for yourself so that you remain open to your own internal signals of knowing and of conscious choice and informed choice, because that ultimately is your expression of your sovereign right to make choices for yourself and your family after considering all of the relevant information. Okay, now I'm going to talk about root canals. Root canals are a very contentious, controversial subject, and there are a lot of reasons for that. For one reason, it's a very emotional thing to be faced with losing a tooth, especially a front tooth, especially if you're young, but really anybody. Nobody wants to lose a front tooth. Nobody wants to have teeth removed from their mouth. It's surgery. You have to heal from it afterwards. It's uncomfortable, although it can be relatively easy and straightforward, and the healing can be pretty quick and uneventful. However, that doesn't change the fact that it is a surgery and there is a recovery. So a root canal treatment seems less invasive because you get to keep your tooth. There's no surgery involved unless it's a surgical case, which complicated things can happen. But basically, an access opening, I'm going to talk about what a root canal treatment actually is and what a root canal is. An opening is made in the biting surface of the tooth or the back of the tooth if possible, preferably not the front or anywhere where it shows. An access opening is made to get into the inner chamber of the tooth, which holds the live tissue, which may or may not still be alive in the case of root canal treatment. So the live tissue in there is connective tissue and nerves and blood vessels and veins and stem cells and everything that normal soft tissue has. So they access that, and in the big part of your tooth that sits up above the gum where you can see it, there's a pulp chamber. So it's a little bigger, it's rounder, and as you progress down the tooth, you get to canal or canals. And those canals are filled with the same tissue that's in the chamber inside the tooth, which is like a little room, a little space. And it narrows down into a canal which goes down the length of the root and out the bottom, or the top if it's a top tooth, because, they're upside down. Anyway, all the way down to the tip of the root and out a tiny opening called the apex at the bottom of each root. And some roots have 2 canals, and most roots have 1 canal with some accessory canals toward the apical, which means closer to the apex or the root tip. The apical third of the root will have more little accessory canals than the other parts of the root. Okay, so those are also filled with soft tissue. It's not easy to clean out accessory canals or canals that are very tiny. Some canals are hard to find, especially a second canal that's in a root is usually really tiny. And anyway, that's technical details. It's the reason why anyone performing root canal treatment really ought to have a microscope, because these things are not only very tiny, but they're way down inside the tooth where there's not a lot of light. So in a root canal treatment, this chamber and then the canals are found. Chamber is accessed, canals are found. And the job of the person performing the root canal treatment is to remove all of the soft tissue from inside your tooth, as much of it as they can get to and reach. And then they put chemicals down in there that burn off or dissolve more of it that they can't reach, but still there's probably some residual that even that can't get to. And then they clean all that out, And then they go in with different instruments, larger and larger and larger, to shape the canal, because if they don't taper it and shape it, then it's too small to actually fill with any material. So it has to be tapered and shaped as minimally as possible to retain as much strength of the tooth as possible. And then they can go in with various types of filling materials, whatever the practitioner is comfortable using. And they fill it from the bottom to the top of the tooth, or from the root tip up into the chamber, and they smooth it down in there, and then a temporary is put in, or a buildup is eventually put in there, which supports the crown portion of the tooth. Or the crown of the tooth is the part that sticks up out of your gums. When you get a crown or get a tooth crowned, that means that the whole part of the tooth that sticks up out of the gum tissue is being covered, capped over by an artificial crown. But that's, when we make a crown, that's what a crown is. But the tooth itself has a natural structure above the gum line called the crown of the tooth. Okay. So that is all well and good. It's been cleaned and disinfected and filled and sealed, and now an onlay or a crown is put on the top because dead teeth become brittle, and so it can break later, especially a back tooth, and so it has to get some kind of sturdy restoration so that you can chew on it and not break it. All right, so that is what the root canal treatment is, and throughout the treatment, x-rays are taken to make sure that the instruments are getting all the way to the tip of the root. All right, now some of the we're coming up on a break here, but what I'm going to talk about in the next section of this show is what some of the pitfalls are of the procedure. Things that I said in the first segment, I'm going to explain further, and I'm going to explain why root canals are controversial and what your choices are when it comes to a tooth that has been diagnosed as needing a root canal. All right, you are listening to Dental MD. I'm Dr. Jessica Saepoff, and we're talking about root canals today. If you have any questions about the topics that I talk about, you can reach the front desk with your questions. The phone number is 425-427-8899, and the email is appointments@naturaldentist.com. I'll be right back after this break.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
New message.
Department of the Social Security Administration. The reason of this call is to inform you that your Social Security number has been suspended for suspicion of illegal activity. If you do not contact us immediately, your account will be deactivated. For more information about this case file, press 1 or call immediately our department number, 326.
This is a scam. Thieves are misusing the Social Security Administration's authority and phone schemes to trick you into giving them money or personal information. They state there is a problem with your Social Security number or account. They claim there's been suspicious or fraudulent activity, and you could be arrested or face other legal action. They even spoof SSA's main customer service telephone number on caller ID. Don't believe them. Don't provide any information. SSA employees will never threaten you for information or promise benefits in exchange for information. In those cases, the call is fraudulent. Just hang up. If you suspect you've been contacted by an SSA scammer, call the Social Security Fraud Hotline at 1-800-269-0271.
Make it a great day. Keep your dial on Alternative Talk 1150.
Now is the time for all good men to come to the aid of my country. 'Tis a free, sweet land.
That was patriotic. Okay, welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff, and today I'm talking about root canals. So in the first section, you could go back and listen to that again when you need to. I described what is involved in a root canal procedure. So one of the reasons that, well, I'm going to talk about why root canals are controversial and what some of the problems can be. So one of the things about root canals, first of all, is just the very mention of them can induce fear and anxiety. Why is that? Because the reason for that is because sometimes when root canal treatments are done, the tooth is not completely dead and a lot of anesthetic is needed. Sometimes they think you're numb and they go in and start and it's painful and they give you more anesthetic and they go back in and they think it's numb now and they go back in and it's not quite numb. You know, nerve is nerve. They do hurt. But the other reason why root canals are associated with pain is because people are in pain, and that's why the root canal is being recommended. And the root canal treatment itself actually gets you out of pain, and the pain stops after the root canal is done. So, but of course, people don't think of root canals. They don't think of pain relief when they think of root canals. They think of pain being caused when they think of root canals. But in some cases, that's kind of unfair. But that being said, here is why root canals are controversial. It is mainly because the tooth, when it is cleaned out, it cannot be sterilized. There's no way to sterilize it. Inside the root are little tiny tubules in the dentin itself, in the root structure. I'm not talking about the canal now. I'm talking about tiny little horizontal tubules that are throughout the entire tooth. And there are a lot of different reasons why teeth are dying or die. Sometimes they die because of trauma, like you were in a car accident and you slammed your teeth together and 6 months or a year later you got a few teeth that are, dentists recommending root canals, and you got cracks, you got pain, you got, teeth dying. Abscess is forming. But that kind of injury, that is not an infection causing the tooth to die. That's trauma causing the tooth to die. So it's not infected. And when they go in and clean those out, they're disinfecting the inside of the tooth with their stuff, but there isn't really a pre-existing infection. Not every time. Dead and necrotic debris inside the tooth, sometimes, actually frequently, no matter what is inside your tooth, if it's dead and slimy and necrotic, they just refer to it as an infection in the tooth. But honestly, sometimes it's not infected. Sometimes there are no microbes involved, and it is just dead from trauma or some other reason. So, in the case of a tooth that dies from infection, like a big cavity that got really deep and the bacteria from the decay, the hole in the tooth, just kind of walked through the remaining small length of tubule that was left, and they walked from the cavity area into the nerve and killed it with their, bad chemicals that they give off. So that's one of the main and most common reasons that teeth die is because of bacteria that get very deep into the tooth as the hole gets bigger and bigger and bigger. Sometimes they invade directly, and sometimes they just send their chemicals down the little tubules into the nerve and kill it that way. And then, they just walk right in to the chamber of your tooth. Another way a tooth can die is if you have gum disease. Your tooth could be perfectly lovely without any cavities and never had any major trauma, and the tooth dies. And you have a gum pocket where bacteria are living under the gum on the root, and they just are marching gradually deeper and deeper under the gum tissue along the root surface. And remember I talked about the little accessory canals that are mostly in the apical third of the tooth? Well, if you have a very deep pocket, you're very likely to have bacteria in an area of your root where they can actually walk directly into your tooth through one of these accessory canals. If that happens, it's called a Pareo Endo abscess, and your tooth will be killed by these bacteria that go in there. But it also can happen in teeth without very deep pockets because, as I said, there are sometimes little accessory canals further up toward the gum line or where the tooth comes out of the gum tissue. There can be accessory canals that high up. Sometimes if you have a molar, sometimes little accessory canals are right in between the roots. And if you have a gum pocket that goes down far enough that the bacteria can walk underneath your tooth to the other side between the roots, that is an area where there are frequently little accessory canals. And when your gum disease gets to that point, it can kill teeth. So now let's talk about when a tooth is dying or dead because of infection. Now bacteria are inside the tooth, the nerve is dying or already dead, and the bacteria are just really happy in there. That's an enclosed space. You can't get at them with your mouthwash and other stuff that you're using, and they're just super happy. It's a nice, protected home for them, and they're not only in the chamber and the canals, they are also invading the little dentinal tubules of your root. Now you're going to, let's say you go to somebody to have this root canal procedure done, and they go in the top and they open it up and they clean out all the dead, slimy, necrotic, infected tissue from inside your tooth. And they go down the canals and they find all the little canals and they put their disinfecting solution in there and then clean it out and do it again, clean it out, do it again and clean it out. And some of it gets into some of the bigger accessory canals, and none of it gets into the tubules. The tubules are too small. There is no cleaning solution that can be put inside the tooth that will get into the tubules and kill teeny tiny microbes that are small enough to live in the tubules. So they wait, stand by, watch the root canal treatment being done, and then they go back to their normal business of living off of diffused nutrients and giving off their very, very nasty toxic waste products called endotoxin. And this endotoxin will just diffuse out of the tubules and into your body. And if you have healthy bone and healthy blood vessels around the tooth, it gets picked up and carried away. But the controversial part of this is just how toxic is this? And can it cause problems in your body? That is where the controversy is. The mainstream of dentistry will tell you that that is not a big problem. But in holistic dentistry, we acknowledge a separate and distinct body of research which appears to demonstrate that these chemicals are toxic enough to be of concern. And so we are not particularly, as a group of holistic practitioners, not particularly fond of this idea of keeping dead, necrotic, and infected teeth in the body. Even if it doesn't hurt, looks okay on the x-ray, chews okay, feels fine, looks great, but is the toxin being given off by all these microbes? It's a variety of toxic chemicals, actually, like a little chemical soup. Is this enough of a problem to justify a surgery to remove that tooth, necessitating all sorts of follow-up procedures to replace the tooth in most cases, like implants or bridges or partial removable teeth or whatever is selected to replace that tooth? There's nothing like having your own teeth. We all know this. Now, in the case of a tooth that dies from trauma, this initially isn't a problem, but do these teeth eventually become colonized? The research seems to show that they do. Once it's dead and it no longer has its own internal circulation, bacteria from your mouth or from your bloodstream or wherever they're coming from, because there are bacteria everywhere and the mouth is colonized, as we know, they do ultimately become colonized. And in the next section of this show, I'm going to talk more about root canals and what the other reasons are that they're controversial. And I'm also going to talk about ozone and other ways to try to mitigate the consequences of these root canal treated teeth. All right, you are listening to Dental MD. I'm Dr. Jessica Saepoff. And if you have questions about any of the topics that I talk about on this show, give us a call, 425-427-8899. We are accepting new patients in Issaquah right now and soon on Mercer Island. And if you want to reach us by email, the email address is appointments@naturaldentist.com. All right, I'll be right back after this break.
Where do I go? Follow the river. Where do I go? Follow the gulls. Where is the something? Where is the someone that tells me?
I'm Dr. Anthony Lazarowitz, and this is Climate Connections. At some Chicago schools, concrete lots have been replaced with gardens, sports fields, and new playgrounds.
We are transforming schoolyards at Chicago Public Schools into beautiful and functional spaces for kids to be active and be outdoors and connect with nature.
That's Meg Kelly with the Space to Grow project. It's a partnership between the Healthy Schools campaign and Open Lands, a conservation organization. She says they plan to renovate at least 34 schoolyards. The areas provide more than a place to run and play. They include rain gardens and permeable surfaces, so stormwater can seep into the ground rather than running off into the streets. That helps reduce neighborhood flooding, a growing problem as climate change brings more heavy rains. Project leaders are educating the community about these stormwater management methods.
We do workshops with parents and community members, and then we're also giving out rain barrels and native plants to start gardens so they can make small changes at home and sort of extend that collective impact.
So from the benefits of outdoor time to helping reduce flooding, the effects of these green spaces extend far beyond the schoolyard fence. Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150. We're on your radio at 1150 a.m. We're on your HD radio at 98.9 Channel 3.
So many ways to listen.
We're on the web at 1150kknw.com. Streaming live audio and video as well as MP3 archives of many of our shows.
So many ways to listen.
And now, we're on your smartphone or tablet. Download our free app in the Apple App Store or Google Play and take Alternative Talk 1150 anywhere you go.
So many ways to listen.
Organic, free range, and fresh daily. Alternative Talk 1150.
I go follow their smiles. Is there an answer in their sweet faces that tells me why I live and die?
Okay, welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. Today I'm talking about root canals. And what they are and what the treatment is and why you might need that treatment and why they're controversial and all of the above. Okay, so why would a dentist tell you that you need a root canal? Before I go into that, I'm going to go back just a little bit and talk a little bit more about controversies, because there's another whole area about root canals that, besides the fact that they're infected, and 100% of them, I mean, the research shows that 100% of root canal treated teeth, when looked at on a slide, are colonized. They are just full of bacteria, full of life, and they're full of life, but the tooth is dead. So this is just like a bacterial, and I don't know what else is in there, nasty little critters, giving off nasty chemicals that are known to be toxic. And as I said earlier, the controversy about the toxic chemicals is, how toxic are they? Are they toxic enough to justify removing the tooth with an extraction, having the tooth pulled, and then having to do something with that space? Or, that's not a very nice option. If people don't think that these things are very toxic, they're more than likely going to choose to keep a tooth, even though it may be non-vital, which is a nice way of saying dead or necrotic. So, or zombie, as we sometimes like to refer to them. So, I'm going to talk about another possible problem. This is more controversial, and not everybody, even not everybody in the holistic community, necessarily thinks this is an important point. But I do think it's an important point, and here it is. You have meridians in your body that run throughout your body, connecting electrically or energetically or however they're connected, and there is an electrical component, because that you can test meridians electrically and see whether they are open or occluded or closed or blocked, or whatever, however people want to word that. And the teeth are also on meridians. So this can be a problem. If you have something on a meridian that is not alive, does it block that meridian? Does it do something to that meridian? Can it cause a problem somewhere else on that meridian? So this is acupuncture science. And there are ways to test to see whether a tooth or an area of your mouth where there used to be a tooth, whether there is something happening in those areas that could be blocking or interfering with the flow of energy in that meridian. And, all of the other structures that are connected on that meridian, according to this science, can be affected by something else on that meridian. And all of your teeth are on meridians, and each one is connected by the meridian to lots of other structures in your body. This seems to be, this is a very important point, because when you have something dead, or even apparently something that, where you had a tooth extracted and the bone didn't heal perfectly, which it doesn't always, that can show up on this testing that can be done. And a tooth that's dead seems to show up. Some show up more important as a blockage than another root canal tooth. They don't all block completely, I guess. Some block a little and others block a lot. And whether if it's blocking and you are having a health problem that seems to be related to the same meridian, maybe you want to do something about that tooth if it's on a meridian where you have other health problems and that tooth is dead or infected or has been extracted, but the bone is showing up on the test as being still blocking something there. So there are a lot of different ways to test these things. A way that I am going to begin to incorporate into my practice is called EAV, or electroacupuncture, according to Voll. Voll was a scientist in Germany that did some research on acupuncture points on the hand. Now, there's no puncture involved. This is using an electrical instrument and a computer, which shows you a graph of the readout of energy on these various points. And there is a way to just sort of go around the mouth and check how the flow is in different areas. So it's very, very interesting. I went and learned about how to do that, and I actually I've known about it for a long time, but I hadn't gone to a course and actually learned how to do it. So my new instruments that I'm going to be using haven't arrived yet, but I'm going to be starting to practice so that I can get consistent with finding the points on the hand so that I can check these meridians. It is really fascinating. So I'm going to be incorporating that soon, and I wanted to just let people know that. So a tooth that is having an issue, let's see, it can be because it's infected or dead or dying or cracked and in distress or traumatized by clenching and grinding. You know, teeth can become temperature sensitive if you're a clencher and grinder, and certain teeth will be more sensitive than others. That's because of the way that you're connecting with them, maybe on an angle instead of straight down, force vectors straight down the root. If they're going off on an angle, that tooth is more likely to be traumatized by your clenching and grinding. And so there are a lot of different things that can create stress in the tooth. And one of the things that seems to be a stressor is obviously if you have decay in the tooth, that can interfere with the energy movement. If you have metal in the tooth or a material in the tooth as a filling that isn't very what we would call biocompatible, that may be contributing to the slowing of the flow of energy or blockage of part of the flow of energy. It's all very fascinating. But, and it doesn't necessarily mean that you have to replace fillings or any of that, but it's just good to know. And if you're very healthy and energetic, then, maybe don't worry about it at this point. But if you are somebody that has, or you could do something about it preventively, but you don't need to. That's a personal choice. But if you're somebody with a lot of chronic health conditions, and this test shows certain teeth to be, more of an issue of blockage, and the areas where you have health concerns seem to be related to those same acupuncture meridians, well, then you want to seriously consider revising whatever it is in the mouth that seems to be a blockage or an inhibition on that meridian. So this is something that will help prioritize whether one tooth should be dealt with before another if they look similar on an x-ray and neither tooth is having any particular pain issue, and you're wondering, about old root canals and whether any of them need to be treated. This test can sort of show if one is more of a blockage than another, and then you might do something about that one first. So that's kind of a helpful use for this test as well. All right, so in the next section, I'm going to talk more about what the signs and symptoms are that would have somebody think that you should get a root canal or consider a root canal or an extraction, because some pain in teeth is, recoverable, like the tooth can recover. We call it reversible pulpitis. Pulp is the name for the soft tissue inside the tooth, so we call that reversible pulpitis, where we believe it can still recover. But irreversible pulpitis is when the tooth has gotten to the point in its symptoms or condition where we don't believe that that the pulp tissue, the live pulp tissue inside the tooth, can still recover. It's like gone over the fence and it's likely to continue degrading or becoming necrotic. But, as a practitioner and as a person, I do personally believe in healing. And frankly, there is a point where the tooth is dead as a doornail and isn't coming back. I mean, that's true. But there's a big gray area where I might say, try this and try that. And if it doesn't work, then, then it's gone past that point. Whereas another dentist might say, just go get the root canal now, because they assume that it's just going to continue to go downhill, because that's what teeth do. And some dentists don't believe that these things can reverse unless it's extremely mild and minor. All right, so I'm going to talk more about that in the next section. Today I'm talking about root canals. You're listening to Dental MD. I'm Dr. Jessica Saepoff. If you would like to become a patient or you just have questions about any of the topics that I talk about on this show, give us a call, 425-427-8899. And you can also reach us by email, appointments@naturaldentist.com. All right, I'll be right back after this break.
Good morning, starshine. The earth says hello. You twinkle above us. We twinkle below.
People join Walk MS to raise awareness and funds that change the world for everyone affected by multiple sclerosis. MS attacks the brain and spinal cord. It's the most common neurological disease leading to disability in young adults. Walk MS brings communities together, creating teams with friends, loved ones, and coworkers to rally around those we care about and end MS forever. Join us. Together we are stronger. Walk MS fundraising accelerates research breakthroughs and life-changing breakthroughs. It will take all of our passion, determination, and fundraising to end MS forever. Together, we can change the world for people with MS. Join us. Register today, start a team, and raise funds at walkms.org.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
On the path to good health and well-being? Alternative Talk 1150 is the station for you.
The earth says hello. You twinkle above us. We twinkle below.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Saepoff. Today I'm talking about root canals, root canal treatments, and I am going to, in this section, I'm going to talk about how do you know that your tooth is in trouble, and aside from the fact that it hurts, because sometimes they don't hurt. Sometimes you just get a swelling in the gum tissue, or something shows up on an x-ray and there's a big hole in the bone at the tip of the root where the necrotic and infected, and sometimes infected, always necrotic, sometimes infected, slimy dead tissue from inside the tooth has blown out the root tip and into the bone and is dissolving the bone and creating a necrotic mess in the bone. That's an abscess visible in an x-ray, they're not always visible. Sometimes they're not very clear, and sometimes they're very clear. And these can also be found using 3D imaging, where it is more radiation, but the area where the tooth is can be imaged on the computer and then rotated around so that the root can be looked at from different angles. And sometimes you can see abscesses that you cannot see in a two-dimensional film or two-dimensional image. We don't really use film anymore. We still call it a film. Very old-fashioned. But the image, because that's on your computer screen nowadays, if you have digital, which pretty much everybody should by now. Okay, so let's say an abscess is found, and there's a dead tooth. It's got an abscess. There's dead bone now also. That bone at the end of the tooth, or between the roots, or mid-root, wherever the abscess is forming, there's no live blood supply there. The blood supply is being killed as the abscess gets bigger and bigger. And so when you take an antibiotic for something like this, because you've got swelling, which is causing pain, at this point, it's not your tooth that's hurting usually. It's actually the cheek and the bone or the jaw or the chin or wherever it is. It's now bothering some local soft tissue near your face, or hopefully not up in your sinuses, which if it's a molar on the top, that can blow through the sinus membrane and become an infection in your sinus or in some bigger vessels, which can bring all of the bacteria from this dead and slimy necrotic tissue straight up into your brain. And then it can cause brain abscesses and death. That's why these teeth need to be addressed. This can be very serious. If it's a lower tooth, the biggest danger is that it could go into the soft tissue under the tongue and into the throat space and cause swelling in an area that can cut off breathing. That can happen. It's rare. But if these are left to just fester and your immune system can't keep a lid on the thing, if it gets into one of the fascia spaces of tissue spaces in between layers of skin and muscle, and it can get into these spaces, and then it can run like wildfire. It can get very big very fast because there's nothing structural that's strong enough to stop it. And so you can end up with some very severe swelling, and it can go into your throat area space or up into your brain and create much bigger, more serious problems. This is why if there is an abscess, it needs to be evaluated. I mean, you may choose not to do a root canal. You might choose, if it's not hurting, and you might one of your choices is to do nothing. That's your right. Your right to do nothing. You have a right to pray over your tooth for healing. You have a right to see anybody you want to, do hands-on healing, or that's all. I'm not joking. I'm not saying those things aren't valid. What I'm saying is that tooth abscesses can be serious. They can become serious. And when you have necrosis, when you have gangrene and osteomyelitis and osteonecrosis, and areas where, even if you took a medicine to try to deal with it, it can't get to the abscess or the tooth because the tissue is dead and there's no live blood vessels or capillaries in it to bring that medicine into that area. So it can disinfect, and kill bacteria around the outside of the thing and maybe keep it from getting any bigger, keeping the bacteria from spreading and dissolving more of your body tissues, more bone and whatever. But that's about all that can do. And your body might wall it off into like a cyst and contain it. Sometimes the body does that. But honestly, one of the very important things to do when these problems arise is to get a professional specialist, preferably, opinion from a root canal specialist first. Get a report that says what it is, where it is, how big it is, whether it's, acute or chronic, or is the nerve all the way dead, or is it dying, or is it still alive and it should be monitored, and don't do the root canal yet because it could still recover. I mean, just get an opinion, get a good 3-dimensional x-ray, get an opinion from someone that treats root canals all the time, and whether or not you choose to go along with their treatment recommendations is a separate issue, but it needs to be evaluated. This is where our allopathic practitioners come in as important to distinguish whether something is life-threatening or not, whether something could become life-threatening, how stable is it, what are the allopathic treatment choices for it now, or in case it does this or in case it does that, as it progresses. And, if it's not walled off and stable, if it's worsening, what are the things that can happen so that you can choose how you want to manage it. And if it's kind of walled off, or it's kind of not acute, or maybe the tooth isn't quite dead yet and you want to try a few things first, sure. I mean, go to somebody more natural and find out what other options you've got. But if it starts to spread, or it gets bigger, or you start to have swelling, or, if this or this or this happen, then you have to do something major, like either, antibiotics, or maybe even systemic antibiotics if it's really gotten bad, or maybe the tooth has a crack and it can't get a new root canal even if you wanted one, and then you're going to have the tooth removed. Now, when it's removed, the little fibers that are holding it in the bone, when they take that tooth out, some of the little fibers aren't stuck to the tooth. Some of them are stuck on the inside of that bone socket still. Those have to be removed because they form a barrier and prevent the bone from filling in well. And then later, after everything kind of heals over and the gum tissue looks normal, sometimes the bone underneath didn't completely fill in, especially if there was an abscess or an area of dead tissue in the bone. If that doesn't get cleaned out real well, that may not fill back in. And even if it is cleaned out well, sometimes it doesn't fill back in perfectly. It all depends on how well your body's going to heal these things. And the surgery should be done in a way to give your body the very best chance to fill it in solidly with normal, well vascularized, that means lots of blood flow, in that healed site. That's why I said earlier, when we're checking everything, we don't just check teeth, we check areas where teeth used to be, because sometimes there is a little drag or impact on a meridian if the bone didn't fill in well, or if it has become a toxic waste dump, which sometimes seems to happen in areas of the bone, that your body doesn't clear it out. It just sort of becomes a little collection site. So that was a lot of information about root canals today. I think I pretty much covered. I did not talk about ozone. Let me just do that real quickly. Ozone can penetrate through bone and tooth and anything. It just flows right in, and as it flows in through, it's so tiny, it just flows straight through the tissues, from what I've been told. And as it does so, it rapidly turns back into oxygen, but as it turns back into oxygen, it kills microbes. It just kills stuff as it goes through. Not you, not your body tissue, because you have antioxidants, but all of the microbes, they don't have antioxidants, and so they can't withstand this oxygen. They like an anaerobic environment where there isn't any oxygen. So when you expose an area to ozone and it flows in, or it gets injected into the area, then it will travel right through and kill microbes. And that may be enough to reverse something, but it may not. You may still have now a disinfected or microbe-free dead zone, and that is still a problem. All right. You've been listening to Dental MD. I am Dr. Jessica Saepoff. If you have questions about this show or any other topic, give us a call, 425-427-8899. And you can also use that number to make appointments and reach us by email if you wish, appointments@naturaldentist.com. Thank you very much for listening. This is the Dental MD radio show. I am Dr. Jessica Saepoff, and I'll be back next week.
The views expressed on this program are those of the host, guests, and callers, and not necessarily those of KKNW, its management, or other advertisers. Contests are the